Yeah, today we released a study that called Medicaid Cuts Will Hurt Illinois' Economy. And the study reports that if the $2.7 billion in Medicaid cuts were to occur, nearly 26,000 jobs would be lost and a decrease of $3.2 billion in economic activity. I think a couple different points that we want to stress is, number one, is if Medicaid is cut, it will not lessen the number of people who will be needing health care, and it will not lessen the number of people who will be utilizing health care services. Quite the contrary. People who have a variety of different chronic illness issues will no longer be able to see primary care physicians, and whether they have diabetes or heart disease problems or others, they will no longer see their primary care physician, and instead they'll be going to all of Maryjane's hospitals. The other key point I want to stress, in the emergency room, which is, we know, is much more costly than going to a primary care physician. And for many years, there have been some good systems that have been built up in the Medicaid program, provider-coordinated care that has decreased the cost in Medicaid and has kept people healthy. The other issue that I want to stress is, for those of us who have private health insurance, we may think, oh, maybe that's good for Medicaid cuts, that should happen. But by slashing eligibility and by decreasing the amount of services, those of us who do have health insurance, we're going to end up paying more in higher premium costs, counter to the political rhetoric by some representatives across the way saying, well, by cutting Medicaid, the individuals in the state's going to save money. In fact, it's the other way around. Medicaid is not just a safety net program. Medicaid strengthens families in tough economic times, which a lot of individuals who are on Medicaid are because of the economic times that we are in. Also, Medicaid is a program that helps provide security for a lot of vulnerable people in the state of Illinois, whether it's nearly 1.4 million children, whether people with disabilities, senior citizens who need long-term care. We're going to be urging the Illinois General Assembly and the governor that no cuts should happen at all. There are some very positive reforms that are happening, and those reforms, such as the PCCM model, which I talked a little bit earlier about coordinated care, is something that needs to be expanded. It not only improves the quality of health care of Medicaid recipients, but starts to save the state money. In addition, there are other avenues that can be pursued that we're happy to talk about later. But we're very happy today and to be working with Illinois Hospital Association and Maryjane.
Yeah, thank you, Jim. And first of all, we appreciate the report that the Campaign for Better Healthcare and Families USA came out, because it shines the appropriate spotlight on how the Medicaid cuts will in fact hurt the Illinois economy. And part of what Jim put a real face on is that these are real people, real jobs, real patients, real communities that are tremendously facing harm. The cuts of magnitude that are being proposed, that we estimate are roughly an 8% across the board cuts, really is just way too far. What we're trying to do in filling up a $2.7 billion spending gap is unprecedented in its size and scale. And we really need to appreciate the type of impact that level of cuts is going to have, not only on the economy, but on real people. To the economy's point, and I think the report does an excellent job of outlining that, is that the hospitals currently hire and employ 250,000 people directly, another total 425,000 indirectly. They're in many counties the top 3, if not top employer in the county. We contribute overall to an economic base here of about $78 billion a year comes from the healthcare sector. And in essence, it's still one of the growing sectors for the state as far as jobs and, again, growth as a sector, which we think we should want to invest in, make strong, to help be part of the path that the state needs to follow as far as getting back on its financial footing. We clearly appreciate the impact and the challenges that the state has in their fiscal crisis, but there are better ways to do it than cutting payments and cutting eligibility and cutting services for individuals, because real harm can in fact happen. Our hospitals are looking at a list of services, their jobs, their benefits to their communities as far as what they will have to consider altering if these cuts come into play. And as Jim indicated, when Medicaid services are cut and lost, they're lost for everyone in the community. If a hospital stops doing OB services, it is gone for the entire community. So the 8% cut is way too far. We want to work with the governor's office, with the administration, but there are real tangible alternatives that can be pursued and further evaluated to help us get on the right path. And Jim outlined some of those. Hospitals are working very hard on moving toward integrated care, care coordination, so that people get the right care at the right time with the right outcomes at the lowest cost. We should be investing. There's good models out there that are doing that. We need to be maximizing federal revenue to the state. Right now, for every dollar that is cut in Medicaid, we simply hand back a dollar to the federal government. This is a time in the Illinois challenges that we should be maximizing every single legitimate dollar that this state can achieve so that we can have a sustainable health care program going forward. We're already 44th lowest in the country in our per Medicaid beneficiary spending. 44th lowest. Well below the national average and well below what other peer states with a very diverse and large population has. So again, how far do we want to go? We need to make sure that it's a sustainable program, not only so that people get the care that they need and deserve, but that the community anchor is there and that we're driving forward with an economic plan for the state that uses hospitals and health care and, again, a sound benefit package for individuals most in need to be able to chart a path through this. We didn't get here overnight. We can't get out of it overnight. We need a thoughtful dialogue with folks like the campaign and others to really say, where do we go from here? Let's plot a purposeful, thoughtful strategy to do it over multiple years.
Was there anything outlined in the governor's plan that either one of you could support?
The governor's plan did include a number of our alternatives. Back in February, when the governor came out with the $2.7 billion figure, he didn't provide any of the details, as you know. And therefore, we worked with our hospitals and others to really come forth with 12 concrete proposals with dollar amounts that, when added up, equaled about $1.4 billion in savings, which was about halfway there to the 2.7. And they did take some of those. They took about verifying eligibility, which is different than shrinking the rolls. It's going through a process to make sure that those that are legitimately on the rolls, in fact, are meeting the current criteria to do that. The governor's proposal, though, undervalued that. They give it an estimated savings of $120 million. We had estimated at a range from $240 to $720 million. They also took different ways to enhance federal match that we thought that were important to that. The hospitals had also put on the table that we're working very hard on quality, we're working on appropriate utilization and reducing unnecessary readmissions. We have put that on the table as hospitals, putting some skin in the game and making it better. They did include that. That's a value of $40 million. But they didn't include some of the care coordination pieces, and they undervalued a number of them. And we continue to encourage them to take another look at our proposals. Let's make sure we're doing the right and thoughtful analysis, because if the end result is that this is a math exercise, when we're talking about real people needing care and real jobs, if it's just about a math exercise, there's going to be real harm that's done out there.
I'm sorry, go ahead.
I was going to say, and we concur with the different points that Maryjane laid out, and we also have supported the cigarette tax as another avenue to be able to bring income.